I'm a nuclear medicine resident, and in my daily practice I see many patients with thyroid-related diseases. That's exactly why I created this video series to clearly explain everything related to the thyroid gland, from its normal physiology to different diseases and the most important diagnostic tools. You can watch the entire series from start to finish, or simply choose the videos from the playlist that interest you the most. This is the third video in a 4-part teaching series about the thyroid gland. In this video, we'll focus on hypothyroidism. I'll explain the different causes, the clinical features, how we investigate it, and how these conditions are managed. Hypothyroidism refers to any condition in which the thyroid gland is unable to produce enough thyroid hormone to keep the body functioning normally. There are several reasons why thyroid cells may fail to produce sufficient hormone. Let's go through the major causes, starting from the most common. One of the most frequent causes is autoimmune disease. In some people, the immune system, which normally protects the body against infections, mistakenly attacks the thyroid gland. As a result, thyroid cells and essential enzymes are destroyed, and hormone production decreases. Although this condition is more common in women, it can also occur in men. Autoimmune thyroiditis may develop suddenly or progress slowly over many years. The most common forms are Hashimoto's thyroiditis and atrophic thyroiditis. In some cases, thyroiditis causes the gland to release all its stored hormone into the bloodstream at once, leading to a short phase of hyperthyroidism, which is then followed by hypothyroidism. Another cause is thyroid surgery. Some patients with thyroid nodules, thyroid cancer, or Graves' disease need partial or complete removal of the thyroid gland. If the entire gland is removed, hypothyroidism is inevitable. If part of the gland remains, it may still produce enough hormone to maintain normal levels. Radioactive iodine therapy is also used to destroy thyroid tissue, and external radiation therapy may be given to patients with Hodgkin's disease, lymphoma, or cancers of the head and neck. In all these cases, thyroid function can be partially or completely lost. The thyroid gland also requires iodine to produce thyroid hormones. Iodine comes from food, travels through the bloodstream, and is taken up by the thyroid. Both too little and too much iodine can disrupt hormone production, and excessive iodine intake may actually worsen hypothyroidism. Sometimes the problem doesn't lie in the thyroid gland itself. The pituitary gland, also known as the master gland, regulates how much hormone the thyroid should produce. If the pituitary is damaged by a tumor, surgery, or radiation, it may fail to stimulate the thyroid properly, resulting in reduced hormone production. When thyroid hormone levels are low, the body's cells don't receive enough stimulation, and many bodily processes begin to slow down. Patients may feel colder than usual, become easily fatigued, notice dry skin, memory problems, low mood or depression, and constipation. Because these symptoms are variable and nonspecific, the only reliable way to diagnose hypothyroidism is through a blood test. Measuring TSH and T4 levels is key. An elevated TSH combined with a low T4 confirms the diagnosis of hypothyroidism. Although hypothyroidism cannot be cured, it can almost always be completely controlled. Treatment involves replacing the hormone that the thyroid can no longer produce, bringing T4 and TSH levels back into the normal range. Synthetic T4 tablets contain hormone identical to the T4 naturally produced by the thyroid gland. With proper treatment, even if the thyroid isn't functioning correctly, normal hormone levels and body function can be fully restored. If you'd like to see more videos where I explain medical topics in a clear and easy-to-understand way, make sure to subscribe and hit the bell icon so you don't miss future uploads. In the previous videos, you learned how the thyroid works and what happens when it produces too much or too little hormone. In the next video, I'll explain everything you need to know about thyroid scans and radioactive iodine.